There are two possible methods which could be used at this stage of induction. The most commonly used method is a pessary, known as a ProPess. However, in some situations, a method called a cook balloon may be advised, and this will be discussed fully with you with your obstetrician prior to your induction process. Before starting the induction or labour, your midwife will examine you internally. This examination is similar to a membrane sweep, as your midwife will assess your cervix to see whether it is open and has started to soften, as well as how low your baby's head is. This will inform your midwife of what stage of induction would be beneficial for you at this time. If your midwife decides that you require a pessary called a prostaglandin ProPess, she will inform you of this and then insert the pessary into your vagina behind your cervix. The pessary contains hormones called prostaglandins, which are released at a steady rate. This may start to soften and open your cervix over the following 24 to 30 hours. Following the insertion of your pessary, your baby will be monitored again on the CTG for a minimum of 30 minutes. During this time, you will be lying down to allow the pessary to absorb moisture from the vagina and to help secure it in position and allow the prostaglandins to slowly be released. This will allow the pessary to slightly swell and prevent the likelihood of it falling out. If the baby's heart monitoring is normal, the monitoring will be stopped. If you're having an induction of labour for being overdue only, you may be able to go home at this point and return the following day. Please let your midwife know or call the triage if you experience any of the following, and we will offer you for a return to hospital to monitor your baby again. These include vaginal bleeding, leaking of any fluids, contractions, or if your baby is not moving normally for you, and any other symptoms which may be an indication or a concern to yourself. You may feel that not much is happening at this stage of induction if your body does not start having contractions, but it is slowly absorbing the prostaglandins and starting to soften your cervix. You may start to feel your abdomen tighten, which may be accompanied by some discomfort or pain that comes and goes and radiates from your back or under your bump. What comfort measures can be used throughout the stage of induction? You may take a bath, as warm water is very soothing and may help you to relax at this stage. Using different positions can help you feel comfortable at this stage, such as pillows, blankets or hot water bottles tucked into your back. Practice relaxation, breathing or hypnobirthing techniques. If you can settle back to sleep, then try to rest. Try listening to music or relaxation sleep meditation to help you rest deeply. If you cannot rest at this stage though and want to get up and move around, you can be upright or using a birthing ball, which we can provide for you on the antenatal ward. You can try using a TENS machine. If you have one, please bring it along with you, or please ask a midwife and we'll see if we have one available. At this stage, if you have signs that labour has started, you may be offered an internal examination. However, too many vaginal examinations are avoided to protect your comfort and to reduce the risks of infections. If you would like any pain relief at this stage, discuss this with your midwife for further options and to understand what is available to you. You may go into labour during the 24 to 30 hours after the pessary has been inserted. If this happens, your baby's heart rate will be monitored and the pessary will be removed. You will then be moved to a birthing room for one-to-one care in labour. What are the possible risk factors and side effects at this stage of induction? Induction of labour is safe for you and your baby. Some people have very minor side effects. You may experience some nausea or diarrhoea. There is a chance that the pessary will overstimulate your uterus or womb, and you start having frequent contractions more often than what is necessary. If this happens, the pessary will be removed and you'll be monitored closely. There is also medicine available that we can give you to help reduce the number of these contractions and to help you feel more comfortable. Unfortunately, birth partners cannot stay with you on the ward overnight to protect the privacy of other people in the bay and on the ward. Birth partners can stay until 10 p.m. and may return at 8 a.m. the following morning. If there are any signs of labour overnight, however, we will make sure to contact your birthing partner so they are able to return. It is also very beneficial for birth partners to go home overnight to ensure that both of you are rested and ready for the next stage of induction. Once you are transferred to delivery suite, your birth partner can stay with you at all times, as you will be in your own private room.